Okay, looks like we are live. All right. Welcome, everyone. This is Dr. Beata. Most people stay in pain for far too long because they're trying to heal the wrong phase of their injury with the wrong approach. And today, I want to shift one of the most important beliefs that you can have when it comes to healing injuries, whether it's a fresh injury or pain that you've been dealing with for years. Because pain is not one thing, and healing is not one size fits all. Welcome to the Healing Injuries Differently Masterclass series. My name is Dr. Beata. And before we dive in, I want to be really clear about what this series is and what it's not. This is an educational masterclass and a real life case study of how I personally approach healing injuries using an integrative whole body lens. I'm not diagnosing or treating, and this doesn't replace individualized medical care. My goal is to help you understand how to think differently about healing, how to recognize what phase your body is in, and how to seek the right kind of holistic support for you. And so if you haven't yet, make sure to sign up for the full free masterclass series. It's in the link below, and I'll add it to the comments as well. So before we again get going, let me know in the comments where you're tuning in from, because as we go through, I'm going to share some resources, and I have a national network of practitioners that I recommend and I can connect you with for in-person care. And also let me know if you are a practitioner watching and what kind, because I'm constantly growing my resource list and I'm happy to add those who are aligned into that resource list. And I also have a mentorship for those who'd like to learn how to integrate this full process that I'll be working through. So if we haven't met yet, my name is Dr. Beata, and I'm a holistic and integrative doctor, and I'm a fellowship trained orthopedic manual physical therapist. And I started working in clinics over 20 years ago now. And then starting in 2012, I completed my doctorate and spent years working in urgent care settings with orthopedic, acute, and chronic injuries. I've also spent years now integrating gut health, holistic nourishment, detoxification, nervous system regulation, emotional energetics, and body decoding into orthopedic and neurological healing, as well as many other digestive, immune, hormonal, and even mental health conditions and challenges. Because I learned the hard way that often the traditional approach is not enough. I remember in the clinic, there were patients that just wouldn't get better. I knew that I was giving them the top-notch orthopedic manual physical therapy care, and there were aspects that I just wasn't aware of at the time. These are now the aspects and the pillars that we're going to dive deep into. And I'm recording this series because just last week, a little over a week ago, I fell in the snow and I did a number on my thumb. There was swelling, bruising, loss of motion, and a real concern about ligament and tendon involvement. And it's not 100%, it's still coming along. But I want to walk you through this process of integrative and holistic healing in real time. Because instead of freaking out or pushing through, I slowed down and listened. And what I want you to walk away with today is the reason why that matters so much. So one of the biggest mistakes that I see, both as a clinician and as a patient, is treating acute pain like it's chronic or treating chronic pain like it's acute. So let's break this down simply if you aren't familiar with that terminology. Acute pain is the body's immediate protective response. So these are fresh injuries. They could be a few hours old, a few days old, or even a few weeks old sometimes. No matter what kind of injury you have, they all begin as acute, whether it is from a fall or trauma, whatever kind of injury it is, or sometimes you just wake up with excruciating pain or with stiffness or with limitation. This is the first phase. When we are in the acute phase, it usually comes with swelling, bruising, heat, limited movement, and often a lot of pain. This inflammation is not the enemy. It's actually part of the healing process. And this is where frameworks like RICE are commonly used in conventional medicine. Have you ever heard that term being, talked about, RICE? What it is, it's an acronym, and each of the letters stands for something. So RICE. The R stands for rest, I is for ice, C is compression, and E is elevation. These are the general guidelines for acute injuries, and they are meant for protection and inflammation management. They're not a cure, but it's a way to respect what the tissue is going through right now. So it allows your body to work through its healing process, and it helps to relieve pain and discomfort in that initial phase. On the other hand, chronic pain is when pain persists long after tissues should have healed. And that at that point, inflammation is often lingering because something hasn't resolved. This could be mechanical, chemical, neurological, or even emotional. This is when pain and limited function persists for weeks, months, and even years. So based on this, let me know if you're watching and you feel comfortable to do so. What kind of injury are you dealing with? Is it an acute injury? So my thumb, for example, is acute. Just happened a little over, actually about 2 weeks ago now, versus something that's been going on for months or even years. Now, here's the key belief shift. Healing depends on phase, not simply on time. Because yes, like I mentioned, there are general timelines that we follow, but ultimately we need to listen to each individual's body. Your body heals based on readiness, the healing environment, the situation, and your nervous system. So for certain kinds of thumb injuries like mine, the healing process would be finishing up at around 2 weeks. For my thumb injury, it's taking a little longer, and that's still appropriate. This is still an acute injury. But this is where some of the nuance happens and where you do need a practitioner guiding you through and helping you decode your body to understand what phase you're in of the healing process. So I also want to say this clearly because it matters, is that there are times when holistic care is not the first step. So if you have an injury and there's obvious deformity, let's say there's a bone sticking out, definitely get medical care as soon as possible. I don't think I need to say that, but I will just in case. But even if there's not a bone sticking out, if your thumb looks crooked, if something looks wrong, please get medical care. If you have the inability to move or put weight onto certain body parts, if there's severe or worsening swelling, if you have numbness, tingling, especially if you have a head injury with symptoms like confusion or loss of consciousness, those are situations that typically warrant medical evaluation right away. So let's say, what I do want to say is that integrative healing and medical care are not opposites. They're partners when we're used appropriately and together, and especially for trauma and injuries like these. So let's say it has been a few days. Maybe you've gone to urgent care like I did and got my x-ray, and maybe you've followed up with your physician. Many will refer you to an orthopedist. Sometimes there's really long waits for that. Did you know, though, that physical therapists are actually trained as primary care providers? It's true. And in the majority of states in the US, you can actually go see a physical therapist without a referral. The one caveat is if you're using insurance, you'll have to check coverage with your specific plan. Now, physical therapists are trained to assess, evaluate, rule certain conditions in and out, and get you started with your rehab plan in a safe way and make referrals if necessary. And I want to say this, that I deeply respect physical therapists. Many hold doctorates, and the reality is that in traditional rehab settings, care is often protocol-driven, one-size-fits-all, and time-limited. There may be little or no hands-on assessment or treatment, no evaluation for tissue readiness, nervous system safely, and definitely not a whole body context. That's not a judgment, it's a system constraint. That's just how the conventional medical system and insurance system guide the care and treatment that you get. So if you've ever been to a physical therapist where they're yelling at you from across the room to just jump on the bike and then go do that exercise and go do that exercise, unfortunately, that is what the insurance and conventional medical system have driven, along with many physical therapists not getting advanced training for many different reasons. Over the years, I've worked in various settings and clinics with amazing mentors. Thank you. If any of you are watching, I'm truly grateful for all of your expertise and guidance and teaching, along with my experience in school, the wonderful professors I've had through the years, clinical experiences, my residency and fellowship in manual therapy, working in an urgent care setting, and now integrating holistic and functional medicine perspectives into this. I call my approach the Radiant Health Protocol. So with orthopedic and neurological injuries, what we look at with this approach is which tissue is injured and what is the pain generator, because that is going to dictate how we create your care plan and how we move forward. What phase of healing is the tissue in? Is the tissue ready for movement? Is the tissue ready to be loaded? Is inflammation resolving or stuck? Is the nervous system in fight or flight? Is the gut helping, or is it actually hindering and creating more inflammation for healing? Are there emotional or energetic blocks that keep the body in protection? So when all these pieces are addressed, healing often requires fewer sessions, not more. We work with the body's natural and innate healing abilities to support it to heal even significant injuries. So can you see that even if you did fracture a bone and you have to be in a cast, or even if you did, something pretty serious and you needed surgery, can you see how these aspects, you can still support the healing process even after surgery, even if you're immobilized in a cast or a splint? This is what a holistic and integrative perspective includes, because guess what? Your body is constantly healing. When we support that healing process, that is when we get the best outcomes. And this is the other piece, is that if you're looking for orthopedic care, I always recommend providers trained in advanced manual therapy, especially those with AAOMPT credentials, residency or fellowship training. AOMPT is a mouthful. It stands, again, it's an acronym for the American Academy of Orthopedic Manual Physical Therapists. This is who I have my fellowship credentials under. And there are different residency programs that certain clinicians have gone through. This AAOMPT credentialing is the highest level of manual therapy credential that you can receive. So like I can say, I can't vouch for every single person, but if you're looking for someone who's highly trained in the orthopedic side, there's a website, it's free, aaompt.org. You can go ahead and search for providers near you. And again, for those who sign up for this full free masterclass series, you'll have these resources in your inbox. Now, these clinicians that are highly trained tend to do deeper evaluations. They give more targeted care and often help people get better faster, even if the upfront cost is sometimes higher, because with this advanced level of training, some may be out of network. This is, again, the trade-off of time and energy that you're getting versus the higher quality level of care and getting back to life faster and feeling better faster. Because when you compare the cost of recurring copays or high deductible plans, you actually spend less with fewer sessions with a highly trained clinician. Now, chiropractors can also be a wonderful resource. I personally know many amazing practitioners, and I can recommend many as well. However, just like my example with physical therapists, you want to go to a chiropractor who is highly trained and specialized. Now, I also have resources for that. And what I also want to mention is this difference between even a holistic physical therapy approach to just chiropractic, because what many chiropractors don't include is the neuromuscular retraining piece. Big word, right? What does that mean? It means training you how to move again, because this can keep you stuck in a loop of just going to get adjusted for months or years without actually resolving the dysfunction, healing the tissues, and retraining the movement, which is where you get well and stay well. So at the end, again, of the session, I'll share some options for you of how to get this holistic approach of care, no matter, again, if you're seeing a PT or a chiro, if you're local or anywhere in the US and even nationally, internationally, I have some resources for you as well. But in the long run, many people actually save time, money, and frustration when you work with a high quality practitioner. Now, there's, again, these are the practitioners that look at the orthopedic side, and you also want to look at this holistic whole body approach, looking at gut health, nervous system regulation, and emotional energetics. That's what I'll be working through this whole masterclass series, so you can start understanding how these pieces come into play and how you can start using these to start your healing journey as well, jump-starting it. So here's this opportunity that most people miss. You don't need more exercises. How many of us have gone to a physical therapist and gotten dozens and dozens of exercises? You don't need that. What you actually need is the right support for the phase that your body is in. Sometimes less is more. We just need the correct thing for what phase you're in and the correct approach for what you're sometimes we need the correct approach for the phase that your body is in and this whole body approach to healing. So when you integrate the orthopedic reasoning with the gut health, with inflammation support, with nervous system regulation and emotional energetics, healing stops feeling like a battle and it starts feeling like a conversation with your body. So if this is resonating and you want to go deeper, again, I'm recording this full free masterclass series and putting together a guide that includes specific resources for when you're in the acute phase and the chronic phase, and even for helping you find providers. You can sign up below for free and get, again, the entire masterclass series and those resources. Inside, I'll also be sharing recommendations for my courses. So if you'd rather work with a general physical therapist, wherever you live. So maybe you're on the West Coast or wherever you are, and then you want to move through the gut healing, inflammation support, nervous system regulation, and emotional energetics with the Radiant Health Protocol, you'll have a clear path to do that. And then if you're someone who wants a more personalized approach, I also offer one-on-one care where we go deep, looking at what actually is going on in your body, identifying your root causes, and mapping out a clear path and plan forward. So if you're local to Connecticut or Massachusetts, that may mean working together with me one-on-one for the physical therapy care and the integrative care. Or if you'd rather not, we can just work one-on-one on the integrative care while you get your ortho and physical therapy somewhere else. And you can still work with me one-on-one. Again, we work through the gut healing, inflammation, nervous system regulation, and emotional energetics alongside your provider. Either way, you don't have to figure this out alone. So over the next videos in this series, I'll be sharing my complete approach to holistic healing. And in the next video, we're going to talk about inflammation specifically, why it's actually essential in acute healing, and why it becomes a problem when it sticks around for too long. Remember that your body is not broken. Even if you have a broken bone or tissue that is injured, your body has the innate wisdom to heal. And it's communicating with you. It's helping guide your healing journey, because healing starts when we learn how to listen. Sending you so much love and healing, no matter what kind of injury or pain you are dealing with. And I look forward to sharing more in the next videos with you. See you soon.